Good morning, good evening, good afternoon. This is Dr. Garais, BIO112, and Unit 4 Laboratory, and this is the eye. Now, we could see here, this is the part of the laboratory that we looked at. You won't be tested on the extraocular muscles, but that's this button right here, where we showed the movement of the rectus muscles, and that's the lateral rectus, medial rectus. Let me highlight the muscles. Lateral rectus and the medial rectus, right, because this is the right eyeball. Inferior rectus, superior rectus to look up, inferior rectus to look down, and then of course the obliques to superior oblique to look up in the right, and inferior oblique to look down into the right. And the right is here, this side here, because we're looking at our patient. Okay. We also discussed this. Let me move this aside. We also discussed how these light rays, how they actually bend, and they all must converge, and you see they're all converging all to the back of the eye, which is the location of the retina. And if you could see here, it's meeting the back of the retina exactly. So you could see how this on this Snellen's chart, capital Snellens, Snellen's, and this is your typical eye chart, how if the light rays are properly refracted to the back part of the eye, you'll have perfect vision. But what happens when you get older? You see the light rays fall a little bit short, and then now you see here, you should see it a little bit fuzzy. Well, what happens if I have an astigmatism? My eye looks more like an egg than it is something round. It's going to mess with it. Same thing with the lens. See here in the picture, the lens is a little off. Therefore, the picture will be off. And likewise for all of these things. So let's shut this off and get to the main part, which you are most probably way more interested in. I'm going to first take out extraocular muscles. Okay, that's it. Now, I'll be removing certain features using this button here, the Invisible Lady tool, which is known to us here in Anatomage as your Explorer tool. But let's look at some things for a second. Of course, this big wire is your cranial nerve 2, your optic nerve, coming out of the back. Here in the front, you'll notice that dome, that clear dome, that is your cornea. Inside your cornea is your anterior chamber of your eye, which is filled with water, and that water is called your aqueous humor. Remember, in Latin, humor means liquid. It doesn't mean ha-ha. You can see the colored part of the eye, that's called your iris. People have different colored parts of their eye due to melanin, and this person has more melanin to protect them against UV radiation. The hole in the middle is your pupil, which is under autonomic control, therefore you have no control over it. Recall the fight or flight. The pupil should dilate, and if it is parasympathetic or feed or breed status, your pupil should constrict. All right. The outer covering here of the eye, and that is called your sclera, and you can see there's a lot of external blood vessels there. So we're going to remove it to get to the other parts. So we use the Explorer tool, and then I remove it. And then after I remove it, what do I have left? I have here the vitreous body, which is the posterior chamber. The posterior chamber of the heart is filled with a gel or jelly-like substance. That is called your vitreous humor. So aqueous humor in the anterior portion, vitreous humor in the posterior. So let's get rid of that. And then the vitreous body, and then what we're left is the choroid, and the choroid part has a lot of blood vessels in it. Let's remove that part. Then it gets to the final part, which is, that's your retina, okay? Let's bring back some things. All right. From there, of course, your retina, innermost layer, has the rods and cones. Rods being night vision and visual acuity, right, or how clear you can see something. And cones are the photoreceptors in your retina for day vision. And they connect into this thing here, that's your cranial nerve 2. And for the exam, of course, the actual area of connection there, that will be your optic disc, or that'll be your blind spot. Another thing that also refracts the light into the proper back portion of your eye, also known as your retina, is this object right here. That's your lens, right here. That's your lens. This lens is then surrounded by ciliary body and your ciliary muscles. That will control on the angle at which the lens is. So you have a clear cornea going through your pupil, that hole, and then you have your lens affected by your ciliary body, which is this thing, and then goes through your vitreous humor in the back part, which will then eventually, from the retina, that's the retinal layer, then to your cranial nerve 2. So those are the items that you'll be tested on. They are here noted on the board. Maybe you can see it. Regarding your eye, extraocular muscles, and just know that they're extraocular muscles. I won't ask you which one's which, but eventually you're going to need to know that. Cornea, pupil, anterior chamber with aqueous humor, posterior chamber with vitreous humor. No retina is the innermost layer. No location of your iris, colored part of your eye, lens, and your ciliary body / ciliary muscle. And those are all the items today for Unit 4. Hope you had a good one. See you in class. Good luck on finals.